Hey, what's going on, guys? Ben Brewster here at TriAthletics.com. This video is about low back soft tissue release work. Now I'm going to show you some partner release techniques, and I'm also going to show you some self-myofascial release techniques. So technically, I can't tell you to go grab a non-licensed partner and have them do these techniques on you. I'm also not a licensed manual therapist. So Gary is my consenting team member, and I'm just going to show you some general concepts of things that therapists have done to me that really help with my back pain. And then you can decide to seek out a therapist on your own to perform some of these techniques, or you can also decide to perform some of the self-myofascial release options that we will show in the video. So just throwing that disclaimer out there before I show some of these techniques that have been really helpful in my personal case, having had chronic low back pain. So there's 4 main points that we're going to address that are very common culprits. I would highly recommend checking out the book Fascial Manipulation if you're curious to learn more about some of the kind of the first 3 points and the reasoning as to why deep pressure and cross frictioning, like these densified spots, can have positive effects for low back pain. So just if you're curious, that's where some of the techniques are from. So we're going to start with the first point, and the first point is right here where this X is. It's basically like kind of this erector spinae mass right here. So we'll zoom in on that so you can get a better look. But that's going to be the first point. The second point is more towards L4, L5. It's lower in the back, and it's going to be kind of over top of the iliac crest. So this is right where the iliolumbar ligament would be. This is common for guys who have a kind of SI joint pain, especially on their landing leg, pain with rotation. This is commonly where that pain kind of originates, and so this is a relevant spot for you guys. And then the final point on the right side here that I've marked is it's kind of where the glute max and glute medius kind of cross. It's going to be that very upper glute on the back of the butt. It's going to be that very upper part of the glute, so that can be a common point as well. And then I've marked the QL here as well as the 12th rib. The QL is very if you research back pain at all, the QL, quadratus lumborum. It's a stabilizer muscle for the lumbar spine, so you basically have one on either side of your lumbar spine. They have little fingers that attach to L1 to L4. They attach to the iliac crest, and they also attach to the 12th rib. So they're basically like guy wires. If you think of like a cell phone tower, it has all these wires that come down and stabilize it, and it gives it this tensional balance. That's what the QLs do. Is they're stabilizers, the deep stabilizers of the lumbar spine, and so a lot of times it'll get blamed when there's low back pain because those immediately turn into spasm and try to stabilize the low back in most cases. And so releasing them can sometimes fix the problem, but a lot of times releasing them will be a part of the solution. But if you just release the QL and then don't do anything else, the pain can just come right back if it's coming from something else, like a disc issue or some sort of misalignment of a vertebrae or something like that. So we're going to work through the QL. I'll show a partner release, and then I'll also show a way you can do this with a lacrosse ball yourself. But just be aware of that. So basically, the idea of the active release work, we can either, so when you're actively trying to like pin and stretch, what you want to do is compress the tissue and then move through a range of motion. I'm going to show you that with the QL. But with the first technique that I'm going to show you, all we're doing is basically just frictioning that tissue back and forth until it starts to soften, until the patient, or in this case, Garrison, basically says that the pain or the sensitivity dies down. If you're doing this on yourself, if you're rolling out your QL, you don't want to just roll over it for 10 seconds and then move on. You want to stay on it until you actually create change to the tissue to where you feel that pain or that sensitivity start to die down. Now this is somewhat more stressful to the tissue, so you don't want to do this every single day. This is something where maybe 2 or 3 times a week, at least for me personally, has been plenty. Otherwise you are going to start kind of bruising the tissue, and it can be more counterproductive than helpful. So I'm just going to show a few seconds on each point just to show how that would look with just kind of the cross frictioning technique. So you can either use an elbow, you can use a knuckle. There's a number of different ways you can do it. We have a massage tool. It's basically like a helper thumb. There's a bunch of different ways to do it. I'm just going to start using my thumbs, and I'm just going to work across this point that I've already marked. If you don't know exactly where it is, you can basically search around that area until you find what feels like the most kind of dense fascicle or dense piece of tissue. And so I've already marked that on Gary, and so what I would do is he would tell me, okay, that's the spot. Okay, once you've found that, and what is that out of 10?
Probably 5.
Maybe it's, okay, maybe that's 5 out of 10. If you're doing this on yourself with a lacrosse ball, you just mentally know it's a 5 out of 10, and you're just going to stay there until it starts to die down.
It's like 4.
So it might take 2 minutes, it might take 3 minutes, it might take 5 minutes. However long it takes, you're staying on it until you feel that tissue start to soften and you feel the pain starts to die down. Same thing down here at the second point. I'm going to kind of search around until I find that problem spot right about there.
Yep, that makes sense.
So we'd stay on there. You can use an elbow. Same thing, stay on there till the sensitivity dies down. Same thing for this top point, thumbs or elbow. And again, communicating, if you are doing this with a partner, just communicate with them. Be very aware to let them know if they're putting too much pressure or whatever. Again, I'm not recommending you do this, just sharing what's worked for me. The QL, when I've had this done to me, what you'll notice is the best way to get to the QL, because the deeper muscle, is to come in from the side. Just personally, you're going to have trouble just directly getting to some of these trigger points in the QL if you come straight down. So coming in from the side, and this kind of goes for if you're self-releasing as well. You can just lay straight on a ball, but if you kind of angle your body and come in from the side, that's when you're going to really feel these deeper layers light up. That's your QL. And so we can kind of find the bottom of the rib cage. The QL is going to be beneath that and deep. So I might start up here. There's all this meat running down. I'm going to come just lateral to that and angle in. And then you can, Gary, you basically tell me when where that's the most painful along the range.
Yep, right there.
Right there. So right at this spot, same thing. I'd come in, and we're going to work that spot. So that's how you would do the QL if you were doing the cross-frictioning technique. If you're going to do active release for it, we'll show what that looks like. So Gary's going to face me, bend the knees to 90. These feet are going to stay on the table to start, but as soon as I tell him, he's going to let those fall off and let that pelvis roll laterally. What that's going to do is I'm basically going to pin the QL, and this is a pin and stretch technique, and then he's going to roll the pelvis away. So we're taking that QL through a lengthening position. And so this is a little bit difficult. You can use your thumbs, you can use your elbow, but you want to still get in and find the same spot. So for him, it's right about there. Okay, we found the spot. Now lower the feet, let that hip fall, back up. Pin the tissue, lower the feet, back up. Pin the tissue, lower, back up. And so just so you guys can see, I'll do one without a ton of pressure, but I'm going right in there laterally, letting that hip fall, back up. So you can actually work your way up and down that entire length of the QL, working through all those dense points. A lot of times it's not just one spot. There's that entire length of the QL will kind of be lit up. Definitely check both sides as well when you do this. So don't just do the points on one side. Hit both points on both sides and at least check for sensitivity. You might only have that sensitivity on one side, but at least check on both sides. So that's how you do it with a partner. Now let's go ahead and show you the self-mobilizations, which I would technically recommend that you do those instead. But again, use your best judgment in terms of finding a licensed therapist to do these techniques on. So for something you can do on your own to release all these points, you can basically put your feet up on a bench or a box so they're roughly bent to 90 degrees. This basically takes you out of gravity. If you're dealing with pretty severe spasm, anything like that, you're definitely going to want to get in this position and give yourself a chance for those muscles to kind of relax out of spasm. Again, would be very cautious if you're in a very acute episode of low back pain and you're very spasmed up. I would definitely get checked out by a professional before you start doing some of these things. When I've been at certain points in my career, I would kind of release the muscle and it would just spasm right back up because that wasn't actually the underlying culprit. So definitely I would recommend doing that before trying some of these different releases. But all you're going to need is a lacrosse ball. I learned this one from Kelly Starrett. And we're basically just going to put the lacrosse ball on those bottom 3 points. For that top point, we can actually just use a lacrosse ball, but going against a wall can work better as far as maneuvering your way around that erector spinae kind of upper point that I showed. But he's just going to find those points, that lateral point, the upper glute point, and then the QL point. So once he finds them, you can kind of just maneuver your feet. You can use your hands to kind of oscillate your body. You can just hang out on the ball once you find a particularly bad, dense point, and just do deep belly breaths and let yourself kind of sink into the ball. That can be good. Just take 5 deep, long, slow 3D breaths, 3-dimensional breaths, and try to let on the exhale, let your body weight just kind of sink into the ball and let those muscles soften. So all of those are good options. For the QL, it can help to, once you find that point, kind of get into it from the side like I talked about. So once you find it, kind of angle the hips at a 25, 35 degree angle and come into it from the side. And once you find it, you can kind of let your upper body relax back onto the table and just keep those knees angled a little bit. So that can make it easier to get into. You're going to feel like you're getting stabbed by a knife when you find the right point. It really is pretty painful, but it's crazy how after a couple minutes it'll go from like a 9 out of 10 to a 2 out of 10 pain. And then you just kind of work your way up and down the length of the muscle for 2 to 5 minutes, and make sure you do both sides for that one as well. I'll show you the one against the wall real quick, then we'll recap everything. And again, just check with your coach to make sure that all of these apply to you, and let them know if you have any questions.